My special guest today is Dr. Frank Jones, who is President of the Royal Australian College of General Practitioners. Thank you for your time, Frank.
You're most welcome.
You've been in the job since October.
Yeah, I have.
Busy time?
Well, I have to say my life has changed. I've been sort of catapulted into this position, from being a frontline general practitioner, which I have still my own practice and I still see patients, and that's what keeps me grounded.
Yep.
Because really that's what it's all about. It's all about looking after patients and having quality outcomes for my patients.
Absolutely.
But I guess I've been involved with medical education and advocacy for the college over the last 6 years as chair of West Australian faculty originally, and also an examiner at the college for many, many years, and also a GP supervisor. I've had registrars in my practice for over 20 years, including medical students as well. So, great interest of mine is in education of the future doctor, and that's really how I kind of came to where I am today, really. I guess the other comment I would make is, I've been increasingly aware of my professional lifetime. The general practice has changed dramatically.
Yeah.
The traditional Dr. Finlay model, coughs and colds, really is not with us anymore because of our changing health demography, our ageing population, and complexity of care, and also increased subspecialisation in Australia. We've got more than 60 subspecialities in Australia, with kind of a world record almost. So it's really, and all those doctors are really important people, but I think that sometimes you have to take a breath in and look at the whole person, and really your general practitioner is the person who can do that for you. So I'm increasingly aware and looking at how general practice fits into 21st century medicine.
Yep.
And this is one of the things behind our campaign, really, is letting patients know that their GP is multi-skilled, that he is the only expert in their whole body, that he looks after not just the physical, psychological, but also emotional health of people.
Now, the campaign we're talking about is the
Good
GPs Never Stop Learning.
Never Stop Learning, which is something we've been working on at the college for about 12 months or so now, and we've just recently launched it about 2 weeks ago. So it's going to be multimedia, but there's also a couple of ads on television which people may have seen as well. And I think it's tremendous what we've done so far, and I think that the feedback that we've had from our members, in the vast majority, has been extraordinarily positive.
Yep.
It's extremely moving, short.
It is.
TV video, if you like, and it does encapsulate the traditional model cradle-to-grave doctor. Now, I know we have new models out there these days. I absolutely understand that, and grey-haired, silver-haired foxes like me, they don't do the 24/7 on-call delivering babies like I used to. Some doctors still do, especially in rural areas. I'm a regional GP myself.
Yep.
But I understand also that people now they're much more mobile themselves, and they may be shifted around from doctor to doctor. But what I would say is that general practice, we actually know now from international and national research, a regular primary care doctor, primary care GP, reduces hospital admissions, reduces time in hospital, yet you get an early discharge. Patients' expectations are improved, patients' experiences are improved. So not just is it good for the patient, it's actually good for the health economy as well. So again, this is raising the profile of general practice and what we can actually offer our communities, because we are part of our communities.
Yeah.
We live and work in our communities, general practitioners. And I think it's a really special privilege to be a GP. I have delivered babies, and then I've gone 2 or 3 hours later to someone's palliative care. Now, what other profession can offer you that? It's an enormous privilege being a GP.
Why do you think the Good GP campaign is needed? Are there not enough GPs, or is there a need to have the general public appreciate their GP a little more?
No, I don't think it's a matter of appreciation. I think it's really a matter of awareness, and I think that people possibly know their GP well, but they actually maybe don't understand the skill base that underlies being a GP, because we are a speciality in our own right now.
Yeah.
And the movement worldwide is into primary care. Yes, we need hospitals. Yes, we need specialists, absolutely. But you also need a coordinator of care, someone who can provide that continuity of care. And again, continuity of care reduces hospital admissions, saves lives. We know this from international research. So again, it's probably not a stakeholder, political, patient awareness of those facts. And that's what this campaign is all about, to increase that awareness of what we can actually offer.
Now, the political scene's fairly volatile around health and immigration and detention and things like that at the moment. What's the college's view of the Border Force Act and its implications for doctors who are working in detention centres?
Look, my doctor's first and foremost priority is with our patients.
Yep.
and we have to advocate on behalf of our patients. It's part of our Hippocratic Oath. So I think that the people who are in detention centres, the threat of doctors not being able to speak out on their behalf is completely wrong.
Yeah. What's your vision in terms of how GPs can help with the domestic violence problem we have in this country?
Unfortunately, I wasn't at the meeting the other week, but I've certainly read about it. I've also just seen the video that we actually produced from the college perspective, which is going to be on our website, by the way. So it's a really good thing, and Rosie's actually on there. Look, again, I've been in my hometown for 30 years as a GP. I've certainly seen more than my fair share of it. It's, you know, statistics tell us it's either 1 in 10 or even up to 1 in 3, some statistics tell that there's some sort of abuse within relationships. So I think the blessing that one has as a GP is to have that trust and empathy and build the relationship over time, getting to know your patient, and hopefully that patient will have interest in me so he or she we can bring the issues for discussion. I don't expect someone to come in and blurt out straight away that there's a problem at home. But again, the great privilege is knowing people over a period of time, knowing their context, knowing where they're coming from.
Yeah.
And there are obviously hints, clinical hints and clinical clues. And really these days doctors are trained in communication skills. It's one of the major contributions that general practice has made to medical education, is in the area of communication skills. We were the first to really start thinking about, because if you think about it, if I'm seeing a patient and they don't actually understand what I'm talking about, then what's the point?
Yeah.
So we have a really good program for our registrars, and communication skills is part and parcel of that. During the course of GP training these days, young GPs are videoed, and we actually sit down, the supervisor and the registrar, and watch the interaction, which is not so much about the clinical content. That's important, of course, because that's what we do as doctors.
Yep.
But as I say, if we can't communicate with our patient, then really, what's it all about?
Exactly.
But communication is at the core. And as I said so many times, I have a consultation, plus I have a conversation.
Yes.
The important person is the patient. It's not about me, not about the medical professionals, not about GPs. It's about the patient. And it's about having that journey, empowering that patient, making sure that it's patient-centred care.
Yeah.
And that is another big change in my professional career.
As you mentioned, you've been a rural doctor. Are you satisfied with the numbers of trainees and juniors who are going through into the rural settings?
Look, I think maldistribution is a problem in Australia. It's a problem worldwide in big geographical areas, and even if you look at areas of Europe and America, kind of the same issues. So the question is how you get people to go and work out there. I mean, I'm biased. I never wanted to be a city or urban-based GP. I always wanted to be part of my community. So, and that's one of the reasons I actually did medicine. But everybody's different. But we do, as a medical profession, as a society, people in rural areas have worse health outcomes. We know this. So there is a maldistribution. So I think, the government, fair dues, has tried to do something about it. That 50% of GP trainees now have a rural attachment during their training.
Yep.
Lots of scholarships through medical school to encourage people to go through rurally. But look, I think it's a societal issue, not just a doctor issue. I mean, getting teachers out there is difficult, getting bank managers out there is difficult. Look, I think it's wonderful to be a country GP. But look, I would encourage every young doctor to go and work in a rural area for 2 or 3 or 4 or 5 years. It's a fantastic experience. You become part of the community. And you can use all those skills that you've acquired in your hospital training. It's a fantastic experience.
Can we talk about the new primary healthcare funding model that you guys are working on? I know you've just finished a public consultation period. What's next? What stage are we at?
Okay, this is a vision for a sustainable general practice for the future, and it's a vision. It's a document for discussion, and it's now been out for stakeholders for approximately 6 weeks. I think the closing date was about 10 days ago. We're now going to put all that information together and rework the documents, rework it a little bit so we can actually make it more applicable, if you like. And we're actually in the process of doing that. We had a meeting this morning. We're still in the process of looking at all the information we've got back. But look, I think the vast majority of people think that it's a good vision, because our present health system is really under strain. It's not geared to look after people with chronic disease. It does very well if you're acutely ill. Yeah. And I don't think there's anything wrong with items of service medicine per se, but it doesn't deal with chronic disease very well. So we are looking at that model. How can we improve How can we get doctors and patients together to walk the journey together to improve that patient's experience, especially if they've got chronic diseases? And so we have to manage the quality of life of those patients and the complexity, the interplay between all those different diseases, the interplay between the drugs. And then, of course, you do get towards the end of life discussion, which is one of my passions. I think that is really something that society needs to get its head around and start thinking about.
Yeah.
I think it is something that I do teach my young registrars. It is a difficult conversation. I'm not pretending it's not, but it's something we do have to have a discussion as doctor, patient, doctor, family, but also as a society at large. We have to have this discussion at some stage.
What's your vision for your presidency? Do you have somewhere you want the college to be at by the time you're finished?
Yeah, look, I think one of the things I said when I first put my hand up to do this job is that I wanted to be, for general practice, to be recognised as a speciality in its own right.
Yeah.
And I think we are getting towards that goal slowly. I think stakeholders and politicians and medical colleges and colleagues and allied health are all recognising increasingly how important, how critical it is to have a central focal medical person coordinating health and giving that continuity of care for reasons I explained earlier on. So I think this coordination thing is really, really important. And no disrespect to any other health professional, I think that the GP is the only one who has the total understanding of the pathophysiology. By that I mean the disease process, how it presents, what are the complications, what are the options of treatment. I don't think any other health professional has that breadth of knowledge, and I think that if I can achieve that in my presidency, I will return to Western Australia a very happy man.
Fantastic. Sounds like a good place to stop. Thanks, Frank.
Not bad. Thanks. Cheers.